The best way to diagnose a food allergy is for a patient to come in and get tested for the food allergies. Many times a patient has already had a reaction to a food and suspects that there's something that they're allergic to. And I always tell patients that, the testing that we do, it finds us the suspects, but it's not necessarily the killer. There are testings that have false positives. So we are looking for what could have been the cause, and then using that with history in conjunction together, try to figure out what it is. Because with food allergies, it's very consistent. If you're allergic to a food, you're not going to be able to tolerate the food every time you eat it. So if you test positive to a food, but you've been able to eat it in the past, then we question that, whether that's a diagnosis, and that's where we have to get a little bit more history. So the best thing is to actually see somebody who actually has a past and experience with dealing with food allergies, because it's more complicated than just doing a blood test or a skin test. People will always ask about blood tests. They'll say, my pediatrician did a test and it was negative. So blood tests are about 70% sensitive, we say, so it doesn't always pick up everything. So, a lot of times I'll have patients that will come in and say, I did this blood test and I'm negative, I can eat these things, but every time I eat this thing, I react. And then we'll do a skin test and we'll see a huge reaction. So it's and sometimes it's the other way around. Sometimes the skin test will be negative, but the blood test will show up. And that's a lot more rare, but it does happen occasionally. So I think the best way is to actually see a specialist that deals with it to diagnose a food allergy.